We think that we are doing the right thing. We are giving interventions like KMC, kangaroo mother care, like CPAP, like jaundice management. But when you have accurate data, it is able to tell you whether you are actually doing it or you're not, because the data will show you what is the number of babies who are eligible for these interventions that are missing out.
The NEST dashboard ideally takes up the data that we have in the unit, like our admission data, our sepsis data, our jaundice data, and then processes it for easier consumption.
Like there before, maybe CPAP utilization was not so high. You could just put the baby on oxygen. But after using the dashboard, you'll see how many babies were surviving.
Before NEST, we never used to have proper data systems. We used to have, it's true that they were not there, but I can say we never used to use them. Maybe we didn't have access to them. We didn't know where they are, and we never used to know what to use them for.
We used to view data retrospectively. Decision making was quite delayed, and at the same time, the data was not as comprehensive.
A mortality had to happen for us to try and figure out what actually happened to that baby.
And then we have nested to help us to track them. So that has been quite useful, especially those of us who are at the global level. It made it so much easier to make decisions. We have data for us to act on.
We are in a position to implement quality improvement projects from the facilities that speak to the county, because it is automatic that the data is there.
I would be able to know what is happening at the facility, what is that is impacting either negatively or positively towards the clinical outcomes at the facility level.
So what happens, even the leadership, they always say, I do not want to see this problem. I remember we went to one facility and for a long time they were struggling with hypothermia at admission. It took the med soup to come and say, I don't want to see this issue again.
Now with real-time data on the dashboard, it's easy to even just predict trends that are happening in the unit. When we were having a decrease in the CPAPs, it's because some of them just hadn't been maintained. They were functioning, but they weren't maintained. But for us, it's the CPAP is spoiled, right?
The dashboard in itself also has some other inputs in terms of device utilization and tracking performance. What comes to my mind is that it has not either been put to rest, so that means it has been running for so long. Maybe some minor checks in terms of the maintenance actions that may be necessary for that device before has not been adhered to. In some cases, you'll find that the device ratios are really demanding. We are all working towards the same goal. We are all about improving the care that is given to the newborns at the facility level.
So the teams are more motivated, and they are also able to see that there are solutions after we put in the quality improvement projects in place.
We not only see our performance, but we are able to compare with other facilities around the country.
Everybody converges on NEST. We have clinicians, we have doctors, we have nurses, we have biomeds, we have health records officers, we have leaders, we have researchers, we have teachers, we have a whole group of people who affect the healthcare system.
With the use of data from the NEST360 dashboard, I imagine 5 years from now that in this world we will have more people with more knowledge.
If biomeds are able to access the dashboard as we deem fit by their own self, they will be able to access the data, interpret it, use it for the necessary decision making at whatever level that they come in.
So I see our governments using this granular level data. That would be my vision. People on the shop floor, people who in the leadership, people in politics, any person who calls themselves a minister of health and is responsible for maternal newborn health, they should know the granular details of what is happening to the mothers, what is happening to the babies.